Welcome everyone to today's webinar, Bridging the Gap, Summa Health's Clinically Minded Approach to Improving Medical Device Security, sponsored by Interoperability. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. James Massey is a Senior Applications Programmer at Summa Health. James has been in the healthcare IT industry for 7 years, while spending the past 6 of those focusing on the integration of various systems into the EMR, as well as administering several other applications. As an application programmer on Summa's device integration team, he has been involved in integration projects with several vendors over the course of his career. In 2016, he became a Senior Applications Programmer and became the lead for all of Summa's device integration projects. Among those was the low acuity vitals integration into Summa's EMR, which was completed in May of 2018. Kevin Nana is a lead clinical systems analyst at Summa Health. Kevin began his nursing career working in an intensive care unit at a large teaching hospital. As a staff nurse, his interest in process improvement evolved and led him to pursue positions as a nurse manager, project director, and adjunct faculty. For the last 10 years, he has worked in healthcare IT, with the last 7 years serving as the lead clinical systems analyst. In this role, he has collaborated with clinicians and IT experts to drive quality care through technology. He has been involved with using Interoperability since 2012 for application single sign-on, medication authentication, and most recently, low acuity vital sign integration. Kevin, I'll now turn the floor over to you.
Thank you, Ayla. Hello, everyone, and welcome. James and I are excited and appreciative that you all took the time out of your day to hear how we at Summa were able to make the process of taking vital signs to be more efficient for our clinical staff and safer for our patients. Before we begin, we'd like to thank Becker's Hospital Review and Interoperability for making this webinar possible so we could share our experiences with you. And of course, James and I are the ones speaking today, but this whole project was a huge team effort among many different individuals. Now, I know when I listen to presentations, I rate them on if I can take away concrete information to use or if they excite me to think about something in a new way. And so that's our goal, is to do the same for you today. We have left plenty of time for the questions following our presentation, so please submit them throughout today's webinar, and we'll get to many questions as possible. We're looking forward to the discussion. Do have one disclaimer. James and I tried to find the quietest place we could at the hospital, but we do have a lot of construction going on, so if you do hear any background noise, it's not part of the presentation, and we apologize in advance for any inconvenience it might cause. Technology is changing the healthcare landscape. This evolution extends beyond transitioning paper documentation into electronic format. As such, hospital IT has moved from a supportive or maintenance role into an integral team member for driving workflows to improve patient financial outcomes. Summa Health has been a part of this journey. For example, Summa is named one of the most healthcare most wired hospitals over the last 6 years. We're also early adopters for meaningful use, which is focused heavily on interoperability. Our successes have been made possible through collaborative relationships with our clinical users to identify opportunities to be more efficient and effective as an organization. Today, we're going to discuss how we saw an opportunity to leverage interoperability between our vital sign device and EHR and lower acuity nursing departments. And by low acuity departments, we're really speaking about the med-surg and telemetry departments. We'll also discuss how we address security risks and maintain data integrity associated to this project. And finally, how we extended the project even further to overcome barriers of adoption and clinical roadblocks. So before I get into the actual content of the project, I want to give you a little history of who we are at Summa Health. We're one of the largest integrated healthcare delivery systems in Ohio with over 9,000 employees. As such, we have many different arms that encompass a network of hospitals, community-based health centers, a health plan, a multi-specialty group practice, an accountable care organization, research and medical education, along with a foundation. From an inpatient perspective, we have over 1,300 licensed beds across our campuses. And here at Summa, we're really moving away from being a hospital company to becoming a population health management organization that delivers value-based healthcare to the communities we serve. As such, we see ourselves as serving a 5-county region in Northeast Ohio that has approximately 1 million people. Interoperability, a growing trend in healthcare. In 2009, the American Reinvestment and Recovery Act and the Health Information Technology for Economics and Clinical Health, also known as HITECH Acts, were passed. The impact to hospitals was better known as meaningful use. Stage 1 of meaningful use began in 2011 with the goal of EHR adoption, and this was highly successful. In the past 10 years, we have seen a 9-fold increase in hospitals adopting at least basic EHR functionality. In 2014, meaningful use stage 2 started. Here, the goal moved beyond adoption to EHR interoperability. Today, the program has been redesigned and renamed by CMS, and that is now known as Promoting Interoperability. And while meaningful use is more widely known, there have been multiple initiatives over the past 15 years to achieve interoperability in healthcare, with the goal of providing data to clinicians that is seamless while securing patient data. Some of these initiatives can be seen through committees like the American Health Information Community or the Certification Commission for Health Information Technology, and through the release of federal strategic plans like the ONC Coordinated Federal Health IT and the Department of Health and Human Services Health Information Exchange Accelerated Strategy. All of these have led to the tipping point for the Internet of Medical Things. So what is this Internet of Medical Things? In the simplest form, it's all the devices around us that collect data related to one's health and transmits that data over the Internet or hospital network to other systems. In the public sector, we see this in the form of smartphones and smartwatches and all the associated apps that come with it. These include apps that monitor your diet, count your steps, even take your pulse, and then can be shared with your healthcare provider. Other examples include home medication adherence tools and personal emergency response systems. However, this discussion will focus on the Internet of Medical Things within the hospital environment. This includes medical devices like IV pumps, telemetry monitors, and vital signs devices, just to name a few. Interoperability is more than just exchanging data for documentation purposes. It's making data available to the right people at the right time in a meaningful way so decisions can be made and actions can be taken. Interoperability allows information that would otherwise require the clinician to access multiple data sources to come to them in real time in a single source like an EHR. When thought of in this context, interoperability becomes a very helpful tool in the coordination of patient care. The ability of these devices to exchange data opens up new opportunities to leverage technology to improve patient outcomes, patient safety, workflow efficiencies, and finances. Yet, utilizing technology does not happen in a vacuum. To have positive outcomes, clinical workflows must also adapt. The two must work in unison, kind of like an orchestra, if you will. In other words, the project aim should not be to fit technology into current processes, but instead understanding how the digital world and clinical workflows can work together to simplify and streamline your organization into a new future state. This is where the collaborative relationship between IT and clinical intersect. So at Summa, we implemented vital sign integration in low acuity areas with the goal to improve patient safety and workflow efficiencies. We already had vital sign integration in our critical care areas. The med-surg and telemetry staff were aware of this, along with the benefits that are associated with it. Therefore, they expressed interest in having the same technology in their departments. However, workflows in the med-surg and telemetry nursing units were very different than the critical care areas. First, in the critical care areas, the vital sign devices were dedicated in each patient room. Vital signs were sent to the EHR at set intervals and validated by nursing before becoming a permanent part of the patient's chart. Second, since this was an automatic feed, there was no vital sign device that would need to be accessed by nursing. So as I discussed earlier, we needed to understand the current med-surg and telemetry workflow related to the vital signs. So here at Summa, beyond nursing, we have nursing assistants, nurse techs, student nurse, that are often assigned the task of taking the patient's vitals. Staff could document vital signs using the PC in the patient's room. So to do this, they would have to log onto the PC, log onto the EHR, find the patient, access the vital sign flow sheet, and then document the patient's vital signs. And of course, log off before leaving the patient's room. Although this is a routine process in documenting vital signs in the EHR world, there are many steps to complete. Staff could also utilize a mobile computer. This could eliminate some of the steps that I outlined above, but they were already pushing around a mobile vital sign device, and therefore it wasn't optimal for them to be pushing around multiple devices. So staff would use what I call the batch entry process. They would take all their patients' vital signs, write them down on a piece of paper. Once they were done, they would find an open PC on the nursing unit and enter all the vital signs at one time. They did this, of course, because it's an efficient process for them. However, it opens up the opportunity for transcription errors. They could document the wrong vital signs on a patient, or if they're like me, they have trouble reading their own writing and they enter in the wrong information. So with these inefficiencies and opportunities for error, Summa made the investment to have vital signs integrated in these areas. This would allow vital signs to reach the patient's chart in real time with less risk of a transcription error. As a secondary goal for this project, in working with nursing, we were able to have the vital sign device capture and exchange other data like safety checks, patient weight, and eyes and nose, which virtually eliminated the need for nursing assistants and nurse techs to document directly in our EHR. This time savings meant staff could spend more time taking care of the patient and less time with the computer. So now that we had the project scope determined and an understanding of the workflow, we turned our attention to security. How do we protect the patient's information, ensure that valid data is being sent from the vital sign device to our EHR, and it supports our future state workflow? We utilize technical safeguards through the use of industry standards like complex passwords and having the device time out within activity. We also make sure that our device software and servers are kept up to date to prevent any security breaches. In addition, if the devices were removed from the hospital, they could no longer be accessed once they lose connectivity with the hospital's network. So we also had processes in place to improve the safeguards for PHI. In order to ensure valid data was being sent from the medical devices to our staff had to scan the patient's wristband. This would link the vital signs to our patient's chart. Secondly, staff had to validate the data before submitting it to be sent. At this step, staff have the option to delete or correct the data before submitting it. They also use this step to add modifiers. So by modifiers, for each vital sign that is taken, they could put in descriptors on exactly what they're doing with those vital signs. So for example, with blood pressure, they can indicate if the patient was standing, sitting, or lying down. And they can also indicate which side, which arm they had the cuff on when taking the blood pressure. So once submitting the data, staff could move on to the next patient's room without logging out, as long as they continuously use the device. At this point, staff would repeat the process of scanning the new patient's wristband, taking the patient's vital signs, validating the data, and submitting it over to the EHR. So phase one of the project was very successful. We were able to reduce the number of steps that staff had to take in order to document vital signs. In addition, we were able to eliminate transcription errors by using safeguards like scanning the patient's wristband and having the electronic transferring of data versus a manual entry to the patient's chart. We did, however, receive feedback, and it mainly centered around the accessibility to the device. Some of the feedback included that staff did not like the out of timeouts, and complex passwords were difficult to enter on the touch screen. As we know, clinical staff are very busy and have to do a lot throughout the day. When workflows are not efficient, they end up finding workarounds. We knew we couldn't eliminate these safeguards and compromise patient data, but we also needed to address staff's concerns. We needed to close the IT and clinical gap to improve user satisfaction. For that piece, I'm going to turn it over to James to discuss how IT works with clinical to bridge that gap.
Thanks, Kevin, for the wonderful explanation on the driving force behind the project. I'd like to talk a little bit about how clinical and IT work together to achieve our end goal. In the constant and sometimes rapid changes that occur in the healthcare environment today, a substantial gap exists between how the IT side of the world views security and by what end users consider as acceptable measures. Security efforts in the healthcare environment as a whole are constantly being undermined by unauthorized workarounds by clinicians, as well as our other employees who are just trying to get their work done in the face of a demanding world that we call patient care. These employees are not trying to intentionally negate security. However, the corners that they're cutting put both the patient's data as well as their own employee data at risk. This is the delicate scale that we constantly attempt to balance as best as we possibly can. See, clinicians sometimes feel that IT implements a solution without considering the actual clinical workflow that's currently in place. IT has no knowledge of the background on why the workflow exists and the struggle that is taken to get it to that point. That sometimes clinicians have a tendency to see IT as the department as in a faraway castle, trying to impose measures for no reason. For example, as Kevin mentioned, the industry standard password requirements are seen by many end users as an annoyance, not as a patient safety effort. From the other side of the story, yet of equal importance, is the fact that sometimes we in IT fail to explain the logic in the decisions that we make in a manner that clinicians can both relate and understand, especially when it comes to the significance and impact that unauthorized clinical workarounds can have on both the hospital environment and the patient's data as a whole. With the evolution of nursing documentation and the automation of that data into the EHR and other systems constantly evolving, the electronic patient record has become a key focus in which health systems have been honing in on for quite some time. The electronic documentation contains huge opportunities where we can improve patient outcome, quality of care, as well as documentation, and boost staff efficiency. We in IT here at Summa understand that nursing represents the largest group of end users in our environment, and as such, we wanted to minimize as many disruptions from their daily workflow as possible so that they could get their documentation done in a timely and secure manner. As Kevin mentioned earlier, in the first phase of the project, it went relatively well. But as the project progressed, it was very clear to us that although the staff were impressed with the ability to integrate their vitals directly into the flow sheets, they constantly struggled with manually logging into the device. Their responses ranged from, it's too time-consuming, I can't remember my password, or the touch screen doesn't seem to get my username or password right. We understood that some clinicians weren't as bothered by logging in as others, because on their units, they might perhaps take vitals once a shift, whereas other units are required to be much more frequent. We also came to find out that although staff were cleaning the devices properly, that sometimes the cleaning agents would leave behind a residue on the screen that made typing in a username and password difficult at the very best. With this information at hand, we went back to our executive sponsors for the project who quickly reorganized our Medical Device Design Committee. The committee itself was comprised of employees stemming from a variety of backgrounds and experience, as well as expertise. We had representatives from executive leadership to clinicians, and that's not just nurses, as well as IT specialists. As a group, we were assigned the task of addressing the authentication process as an area of opportunity for improvement and to collaborate in making the solution even better. At this point, Clinical had already fulfilled their part of the project by designing the scope and purpose of the capture of the vital signs. They had decided what vitals were imperative, as well as what vitals would be beneficial but not as necessary, and even assisted in showing us exactly where they wanted the vitals to go in the patient's flow sheets so that they could find them as quickly as possible, and all members of the patient care team could be immediately aware of the patient's current status. With that being said, it was now our turn in IT to dig deeper into the low acuity device capabilities to see what solutions we could come up with to help out our clinical staff. As we delved into the low acuity devices further in the back of our minds, we were looking for a couple important things in a solution. First, we wanted a solution that would make it easier and quicker for our staff to authenticate. We wanted to achieve workflow visibility. What that basically just meant was the ultimate goal was to perform as much automation as possible. In hopes to achieve this, we were going to both increase the throughput of the vitals into the EHR while decreasing the number of labor-intensive human touch points for the staff. On the other side of the coin, we in the IT industry are becoming, although technology is becoming more intuitive and convenient, the protection of the patient's personal information becomes more important, and we have to take a more precautious approach than we ever have. We wanted to stay ahead of the curve to ensure that our technology, our infrastructure, and our security provided the appropriate amount of control over who could access the data, thus minimizing any potential for a breach. Combining these ideals with the large push that has been going on over the past few years in the IT community to streamline our workflows was also a goal. Why should we have several platforms that perform the same task? So an enormous boost for us was if we could achieve the ease of use that Clinical needed with the security that IT required, all while utilizing a solution that was already in place. After working with the vendor of the low acuity devices, we narrowed the solution down to 2 potential vendors who met our requirements. When we presented those vendors to our clinical champions, they identified Imprivata as a system that they were already comfortable with, that had also benefited them in the past of streamlining other authentication workflows. The tap badge feature that Imprivata was utilizing provided for the low acuity devices that made the process easier and more user-friendly by allowing the staff the option to either log in with their username and password, which was fine if you were taking vitals once a shift, or for more frequent vitals collection, just tap their employee ID badge. The tap badge feature was also advantageous for another reason. As part of the integration with the low acuity devices, staff members are also able to document more than just vital signs. Kevin touched on this earlier, but they're also able to document items such as inputs and outputs, safety checks, and other patient demographics. So the quick sign-on feature allowed the staff not only to streamline their vitals, but also to streamline their safety checks, which added to the staff's excitement, as you can see here by the comment from Evan Deegan, one of our unit directors here at Summa Health. The challenge when it comes to ensuring adoption is when some clinicians have doubts about working in a nursing environment that's filled with technology. Even though they're provided with instructions, screenshots, and cheat sheets that are helpful, some staff still have a hard time adjusting to any new technology. These hesitations can stem from a variety of things, such as their own insecurities when it comes to working with technology in general, whereas others are more afraid of sending inaccurate or incomplete data into the EHR. Both of these fears lead to clinician aggravation in which they can't perform their electronic tasks in a timely manner. We felt that in order to guarantee a successful adoption of the low acuity vital solution with the TAP badge functionality, it was important to incorporate the varying degrees of the clinician's perceptions, as well as their knowledge base and comfort level in the technology they were utilizing. The key adoption boiled down to, once again, finding the right balance between ease of use and security. Knowing this beforehand, our in-house device integration team assumed full ownership of the task of training super users for every department, both prior to go live as well as in the days that followed. We worked with nurses, nurse assistants, student techs, directors, and many more, providing multiple days and times for scheduled seminars, as well as taking the devices to the units themselves and providing opportunities for the staff to be able to look at the device in between performing tasks that would otherwise restrict them from leaving their unit. We wanted to be sure that the staff had an ample amount of time to familiarize themselves with the devices so that they would be comfortable prior to implementation. More importantly, we championed the training because we wanted to be side by side with our clinicians as they utilized the devices so that we could address any questions, concerns, or insecurities about the product or the authentication process with the TAP badge, rather than letting them grow frustrated and waiting for a response from IT. We wanted to answer it firsthand. We continued to round after the go live and still continue to round today for any unit that requests it or if they seem to be struggling. Typically, adoption happens very quickly, however, due in part to the environment that we have set up to streamline employee access by incorporating both policies and controls from both Active Directory and Imprivata. Upon an employee's hiring, we have worked with Clinical to identify certain job roles that would definitely require TAP badge authentication to the low acuity device, and those roles are added to the appropriate permissions group to ensure access so that on their first day, the clinicians are ready to hit the ground running with the devices. When you combine the streamlined workflow with how excited the staff are for the integrations, they take it upon themselves to train others so that they too can reap the rewards of Vitals integration and TAP badge authentication within the first few days of their tenure here at Summa Health. By utilizing the TAP badge solution, we were able to both ensure compliance with our existing security measures, as well as streamline the authentication process for the clinicians, which made them ecstatic, as you've already seen by some of their reviews and comments throughout the presentation. As a matter of fact, when we combined our network infrastructure security measures with the device security features such as screen lock and auto logout, and the enhancements provided by Imprivata with the TAP badge software, it provided an improved culmination of security that leveraged not just one, but multiple systems to protect our patient information. Obviously, the clinicians were elated with being able to be more efficient with their time by utilizing the Vitals integration and the TAP badge functionality instead of manually typing in their usernames and passwords, which freed them up time for other tasks such as boosting patient satisfaction and paying even more attention to patient safety. One of the department director's comments that we received back as a result of the TAP badge rollout was that the Vital Signs integration with the TAP badge feature gave their staff back an average of 1 to 2 hours per shift, which they could then use that time to re-engage more with their patients, to pay closer attention to patient safety. Another comment, which is seen here that reflects the success of the project, is from Tiffany Kurtz, one of our clinical coordinators in our infusion department. We believe that the solution that we have put in place here at Summa Health has allowed us to bridge the gap between clinical workflow and device security by eliminating the need for manual charting and allowing our staff to utilize both the TAP badge and or manual authentication as a process for them to log in. And as a result, our clinicians couldn't be happier. Hopefully our experience that we've shared with you today has been helpful, but we understand that some of you may have some questions that relate to your own environments and your own personal experiences. With that being said, we'd like to turn the presentation back over to Ayla to facilitate any questions that you may have at this time.
Well, thank you, Kevin and James, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. And we will try to get through as many questions as we have time for. We've already had several questions come in today, so we'll go ahead and get started with those. And the first question that we have, and this is for either Kevin or James, whoever would like to chime in, it is, how far ahead did you start the planning process before full implementation started?
That's a very good question. This is James. I'll go ahead and answer that. The total length of the project for us was probably about 9 months. So we started planning about 9 months in advance when our device committee re-met, and we started looking at the vendors. We went through the normal purchasing process as well as the testing. So from beginning to end, by the time we were looking for a TAP badge solution to deployment, was about 9 months.
Great, thank you so much. And we'll go ahead and move on to the next question now, which has to do with the TAP device. And this person wants to know, so the TAP device is attached to the medical device, which is being used to capture the vitals. They were just wanting clarification on that.
Yeah, so this is James again. Another excellent question. The TAP device is actually a module that connects to the vitals collection device by USB. So yes, it is physically connected to the vital signs device. It's not there's no cord, it's just a module that connects directly to the side of the device.
Great, thank you so much for that clarification. The next question that came in has to do with security risk. And this question is, how did you mitigate the security risk if a doctor or nurse misplaces a badge? Couldn't someone find the badge and simply tap to log on as the provider and make changes to notes, orders, etc.?
Hi, it's Kevin. So the information that's being integrated between the device to the EHR is limited to the vital sign information and the accompanying information like vital signs and I's and O's. So if a badge was lost, they would not have the ability to modify any orders in that regard. The way we mitigated that are a couple things. If they lose a badge, staff can call the IT support line, which is supported 24/7, and we can immediately disengage to deactivate that badge so it can no longer be used as a TAP badge process. When that happens, staff would then have to manually type in their password to access the device until they're able to get a new badge, and at that point we would re-enroll them into the process. In addition, to get onto the device, you would have to actually physically have access to the device along with the badge and then go into a patient's room and scan the patient's wristband. So there would also be some questioning by staff on why someone who's not authorized to use that device would have access to it.
Great, thank you so much, Kevin, for providing that clarification there. The next question also has to do with the badges as well. The question is, how does the badge swipe affect the need to have end users change their passwords every X number of months?
So this is James. I'll take that question. The prompt to change their network password every few months is managed by a separate system, which is integrated into the TAP badge solution. So the TAP badge software has the integration with whatever password tool you might be utilizing, whether it's Active Directory or what have you. So that is automatically updated as long as the employee's badge is still enrolled in Imprivata. Those systems work hand in hand to make sure that that takes place.
Great, thank you, James. And we have another question that just came in as well about the badge. And this person is wanting to know, did you pilot the tap badge solution within some units before implementing it fully? And if yes, how did that pilot go?
Yes, so we did implement or pilot the solution as well as had a partner organization that was already utilizing a slightly older version of what we were planning on introducing, and they had already had great success with it. We were able to get a couple devices on site for our medical device design committee to practice with, and they were able to go around and then use that to practice collecting vital signs just to make sure that it was something that we wanted to look into prior to dumping data into the patient's EHR. So our partner organization at that time had plenty of success with it, and our medical device design committee had the opportunity to completely reject the idea if they weren't happy with it, but they were happy with it. So at that point, it just became time to deliver that data to the EHR.
Great, thank you so much. That's really helpful to understand. And then we've had several more questions come in, so we're just going to keep moving through those. And then this question is it's a multi-part question. And the first part is, did you standardize your vital devices across the system? And then did that require you to work with vital instrument vendors to add the IO and safety checks? And did you find only that certain medical device vendors could accommodate the TAP badge solution?
Sure, so I'll field that question a little bit. So yes, we did standardize our vitals devices across our health system. Any of the inpatient units, as well as some of the outpatient units that saw patient volumes or used the same EHR, we tried to make it standard that the vitals collection would all happen from this new device for a couple of reasons. First of all, we wanted to make sure that if you floated from one department to the next, you were comfortable with the technology. Once again, we felt that if we were going to have a high adoption rate, they had to be comfortable with how to use the device to send the vitals, as well as how to log in. So yes, we did standardize across the health system. We did work with vital instrument vendors. However, the device that we selected included a lot of the peripherals with it. A temporal thermometer, a barcode scanner, SpO2 sensor, blood pressure cuff were all part of the low acuity device that we had. So all of that was standard with that vendor. So we didn't have to do too much checking outside. Most of it came with it. As far as working with certain medical device vendors, we found that only 2 or 3 possibly were able to accommodate the security that we needed, as well as the ease of use that the clinicians desired. We were able to very quickly narrow it down to 2. One of them was geared more for an outpatient environment rather than the inpatient. But we were able to narrow it down to 2, and we presented those 2 back to our clinical champions. At that point, they took that information, and Imprivata was the one that they felt more comfortable with, the staff felt more comfortable with. So at that time, they elected as a board to go ahead and move forward with that solution.
Great, thank you so much. And we've had several more questions come through, so I'm moving through the list now. And this next question, it has to do with IT security, but it says, can we bring IT security into it to push the solution through? Do you guys understand what that question is asking?
I'm not quite sure what the question is asking. I can tell you we work very closely with our IT security team to make sure all their standards were met. We used a very layered approach when it came to the security, utilizing multiple systems, such as Active Directory and Imprivata, among others. So we worked with them hand in hand. They were very hands-on in the process to make sure that we were protecting the patient's data adequately.
Thank you so much for that clarification. And now we're shifting gears a little bit. The next question has to do with training, clinician training. So the question is, clinician schedules are very tight. How were you able to find time to do training, and how much training was needed for them to feel comfortable with the process?
Very good question. We worked with the clinicians quite a bit. We understand that a lot of times in IT, we try to put out there that we need you to attend this class at this time. And we understand that that's not very practical for the clinicians, because when they are here, their time is allocated to take care of that patient. So what we did was we tried to provide the best of both worlds. We set up several days and times. We came in early at 6:30, 7 o'clock to train the night shifters as they were leaving. We stayed late to work around their schedules, because we knew if we weren't able to work around their schedules and get them comfortable with the device, adoption wasn't going to happen. But we wanted to take it a step farther than that. That's where we took. So we did a train the trainer mentality, where we talked to every department that was going to receive these devices and asked them to give us the name of 2 to 3 super users who we could train to help the staff be more comfortable. At that point, some of the departments that still weren't comfortable, we were able to deploy the devices in a test environment so that they could have them in their staff break rooms or whatever have you, to practice taking vital signs on each other to get comfortable with the device. As far as sending the vitals to the patient chart, it's a relatively simple process once the patient's associated with the device, so we felt comfortable they'd be able to handle that through training. But we wanted to take that a step farther, so we took the devices and rounded with those super users during lunch times and break times, and left those devices there, as I mentioned, just so they could be as comfortable as could possibly be, because we knew that was the only way they were going to really latch onto these.
Great. Thank you so much for explaining that process to us. And we're going to go ahead and move on with a few more questions now. And this question is on a topic that I believe you touched on earlier, but how is access control accomplished? Who has permissions to access certain devices that require qualification?
Thanks, this is Kevin. So with access, we control that through our AD process. That's the initial front. There's an AD group that we assign to the appropriate user. So one of the benefits that didn't really come out through the presentation, but we were able to accomplish, is identify all of the job descriptions that are appropriate to have this access and have it automatically assigned to them when they're being onboarded to Summa, or if they were already employees, we at that point had it assigned to them. So it's really based on their job role and what department they are working in that they get assigned to that access. Once that happens, then there's an enrollment process of enrolling the badge into Imprivata so that it works, and between that provides them access to it. And without completing those 2 steps, they're unable to access the device.
Great, thank you so much. We've had a few questions come in so far about what device manufacturers Imprivata works with. And just as a side note, Imprivata currently works with various models of capsule, Welch, Allen, and Phillips devices today. So just to provide a little bit more information on that as well, since we've had a few different questions about that topic. But the next question that we have for Kevin and James is, which departments or users benefit most from the new authentication workflows?
Good question. I would say the immediate impact is really to the non-licensed nursing staff. And I say that because they're the ones that are frequently taking the vital signs and send them over. However, as James said in the presentation, the benefit of them saving 1 to 2 hours per shift by having this workflow change. It also really benefited nursing because it freed up this ancillary staff, if you will, to do other things to help nursing. So it freed up nursing to do other things as well. And it really benefited nursing departments, but as we rolled it out, some of the ancillary departments like our interventional radiology became interested in this technology. So they also adopted this type of workflow and found it useful because of the frequency that they take their vital signs.
Great. And thank you so much. And it looks like we have time for a few more questions. The next question is, how often are clinicians required to authenticate devices in your environment?
So the authentication they need to complete with each time that they access the device. The only caveat with that is if they are, once they access it, if they're continuously using the device, as long as it doesn't time out, which is about a 15-minute time frame, then they don't need to re-authenticate. But if they do walk away or get interrupted with patient care in between taking vital signs and then come back to the device, they would have to re-authenticate to get back on.
Great, thank you so much for that clarification. And it looks like we have time for about one more question, and I'll go ahead and move on to that one. The question is, what issues did you experience throughout the project? So if there were any issues or challenges you experienced, they would like to hear about those.
Great question. This is James. I'll take that one. As a part of this project, it was a part of a larger EHR project that kind of had the umbrella over this one. So one of the things we were already doing was we were already upgrading our wireless networking environment as well as the equipment that it was connected to. So we had minimal issues with wireless or network connectivity because we were already working on that with a separate project. One of the reasons that we felt that Imprivata asked us to present was that our implementation was actually very straightforward, outside of the required upgrade that we needed for our environment. In order to support the TAP badge, we did have to do a software upgrade on our Imprivata system to allow us to utilize that feature. Other than the upgrade, our only other, and I wouldn't even call it an issue with the project, it went very, very well, but the only other issue was educating the staff where to tap the badge, because the low acuity device has an icon that's it's not in the best place. It's in a place that requires a little bit of intuition from the staff, but they're also not sure of where the chip is in the badge to tap in. So working with the staff, just getting them comfortable with the location, how long to hold the tap badge up, which is just a couple seconds, was probably our biggest headaches. But compared to other projects, those weren't very big at all.
Great. Thank you so much for walking us through that process and how some of those small issues that you encountered. It looks like we've kind of worked through most of our questions, and that's about all the time we have for today. But I want to once again thank James and Kevin for their excellent presentation, and to Imprivata for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.